How do oxygen concentrators work? After the second wave outbreak of the COVID-19 pandemic, oxygen concentrators are in huge demand. In fact, in countries like India and Nepal, the need for medical oxygen at this hour is unabated. Unfortunately, in this situation of crisis, most states are struggling to meet this demand. But what exactly is an oxygen concentrator? And how does the device work? Worry not. In today's video, we have discussed everything you need to know about oxygen concentrators. Watch till the end to find out if all oxygen concentrators are the same. Subscribe to our YouTube channel for more such videos. We post new videos every week. What is an oxygen concentrator? Well, it is a medical device that is used to concentrate oxygen from ambient air present in the atmosphere. Atmospheric air contains about 78% nitrogen and 21% oxygen. Other gases make up the remaining 1%. An oxygen concentrator looks like a computer monitor, only bigger. With COVID-19 infections rising, an oxygen monitor is the most effective device for oxygen therapy, especially for patients in home isolation and for hospitals running out of oxygen. Unlike medical oxygen that is sourced from industrial units, supplied via devices like oxygen cylinders, oxygen concentrators can be operated at home. Watch till the end of the video to find out the difference between oxygen concentrators and oxygen cylinders. When do you need an oxygen concentrator? Once blood saturation levels drop below 94% in COVID-19 patients, it can be a serious sign of respiratory distress. In most cases, this would mean hospitalization of the patients. However, due to the surge in COVID-19 infections and shortage of hospital beds and oxygen supply, oxygen concentrators can come in handy, helping those who can't access hospital services. Therefore, if a patient's oxygen saturation levels drop between 88 to 92%, they would need an oxygen concentrator. It must be kept in mind that if the oxygen saturation levels drop any lower, it would mean more intensive oxygenation. And if the oxygen saturation levels rise higher, it would indicate an improvement in respiratory and lung infection, thus obviating the need for an oxygen cylinder. What does an oxygen concentrator do? As we mentioned before, an oxygen concentrator takes in air from the atmosphere, separates the oxygen from nitrogen and other gases, and delivers it to the patient via a nasal cannula. Generally, the air is 79% nitrogen and other gases, and 21% oxygen. But when an oxygen concentrator is plugged into an electricity source, it delivers air that is purified and contains about 95% oxygen. Thus, in respiratory infections like COVID, where oxygen concentration level falls below 94 to 88%, oxygen concentrators can ease the burden on the lungs. However, remember that in severe cases, some patients need 99% pure oxygen. In that case, oxygen concentrators won't be enough. How do oxygen concentrators work? Oxygen concentrators usually consist of a sieve bed filter and compressor. A compressor is used to squeeze atmospheric air and adjust the pressure at which it is delivered. The sieve bed filter is made of zeolite that is used to prepare oxygen from nitrogen. Two sieve bed filters work to release oxygen into a tank that is connected to the nasal cannula as well as release the separated oxygen. This forms a consistent loop that keeps producing fresh oxygen for patients with respiratory complications. Are all oxygen concentrators the same? Oxygen concentrators are available in the market with a wide variety of specifications. Thus, varying oxygen concentrators provide varying oxygen outputs. For COVID-19 patients, oxygen concentrators that have a 5 liter to 10 liter output are recommended. However, what is most important is that the oxygen concentrator should deliver air that has at least 90% pure oxygen. The cost of oxygen concentrators varies between 40,000 rupees to 90,000. Besides, there are pulse and continuous flow oxygen concentrators which deliver oxygen at a constant rate and uses a sensor to deliver a puff of oxygen every time the patient inhales. Difference between oxygen concentrators and oxygen cylinder. Both these devices deliver oxygen to patients who require it. The main point of difference is the method in which it is delivered. Oxygen cylinders usually contain a finite amount of oxygen compressed within them. This is inhaled by the user till it runs out. Oxygen concentrators, medical grade, on the other hand, filter and produce medical grade oxygen at an infinite supply, at least till the battery that runs the device runs out. Experts have said that oxygen concentrators are more beneficial than oxygen cylinders due to a number of reasons. Oxygen concentrators are more consistent, and it takes time for the device to run out of power. It is also much safer to use as oxygen cylinders could leak and cause the risk of a fire. Therefore, if you are considering whether to give a COVID-19 patient an oxygen cylinder or an oxygen concentrator, it is better to go for the latter. If you found this video helpful, like and subscribe to our YouTube channel. That's all from us today. We want you to know that your voice is important to us. So please leave a comment below. If you are new here, then click the bell icon for notifications of our new videos. And subscribe to our channel.